Welcome to Dr. Imran's Official. Today we will discuss about herniated disc, its causes, symptoms and treatment. A herniated disc, also known as a slipped or ruptured disc, is a spinal condition where the soft, jelly-like center of an intervertebral disc pushes through a tear in the outer layer. Here are some key points about herniated discs. Causes: herniated discs can result from age-related wear and tear, injury, or strenuous activities that put pressure on the spine. Symptoms: common symptoms include pain, numbness, tingling, or weakness in the affected area. The location of symptoms depends on which part of the spine is affected. Diagnosis: doctors use physical exams, medical history, and imaging tests like MRI or CT scans to diagnose herniated discs. Treatment: treatment options vary depending on the severity of symptoms. Conservative approaches include rest, physical therapy, and pain medications. In some cases, surgery may be necessary. Prevention: maintaining good posture, regular exercise, and proper body mechanics when lifting heavy objects can help reduce the risk of herniated discs. Complications: if a herniated disc compresses a nerve, it can lead to conditions like sciatica, which causes pain radiating down the leg. Prognosis: many people with herniated discs improve with conservative treatment and lifestyle changes. Surgery is usually reserved for severe cases or when other treatments haven't been effective. It's essential to consult with a healthcare professional for a proper diagnosis and treatment plan if you suspect you have a herniated disc, as individual cases can vary widely in terms of symptoms and severity.